I'm Dr. Arjun Dang. I'm the Chief Executive Officer of Dr. Dang's lab. That's a quality-based lab situated in Delhi NCR. So when we speak about diagnostics, why it's so important is that because 70% of all medical decisions are actually based on a lab report. Now, when we look at the globe from a bird's eye point of view, the number of tests that are performed per patient are extremely high. When you look at the Americas, it's about 12 per patient. When you go down to South America, to countries like Brazil, it comes down to about 6 to 7 a patient. In Europe, in the NHS, it's again about 7 to 8, Eastern Europe being about 6 to 7. But then when you come to India, it really staggers down to about 2 tests per patient. Now, why that is happening? Obviously, because in the West, a majority of the spend is insurance driven, and in India, majority of the OPD diagnostics are not covered within insurance. But then again, what also has to be kept in mind is something that I like to call as hyposcalemia. So it is the increasing dependency of young doctors on prescribing tests that are not actually required. The age-old methodology of actually examining a patient from head to toe and gaining a lot of knowledge regarding what could be the diagnosis is going amiss. It's probably because of the lack of quality academics. I won't say the lack of quality academics, but the robustness of the system, and definitely collaborations and steps need to be taken effectively to increase and strengthen the education system so that this entire challenge of hyposcalemia can be combated well. Again, when we look at India and the diagnostic structure here, diagnostics has partially, I'm very sad to say that, but has been partially commoditized, where tests are done and reports are given out. The counseling and the empathy of the doctor and the time that the doctor actually spends with the patient is really minimal. Pathology has actually become a field that is more of a back-end field, and what I would aspire to do and would encourage all the young pathologists and lab doctors out there would be not let it be a back-end specialty, but be a front-ending specialty. When I say a front-ending specialty, it's more about speaking to the patients when there's a neonate, probably doing the phlebotomy themselves. So I have a real-life story where there was a small baby and they had come for sampling, and it was a difficult vein because they had gone to multiple labs before, and no one had managed to do the phlebotomy effectively. And I stepped up and I told them, okay, sure, I'm being an MD pathologist and a specialist, I still said, okay, I'm going to go through with the phlebotomy. Just in the process of me taking the sample, I managed to speak to the mother at length and got so much history about the baby that actually helped us reach an effective diagnosis, out of which the lab work was probably 30 to 40%, but more than that, 50 to 60% was the information and the knowledge that I gained after speaking to the mother. So again, we have to look at it in a more holistic way, where lab work is not just some values written on a piece of paper, but they actually dictate the diagnosis, the management, and the treatment that actually leads to the way forward. Again, commenting on India and the diagnostic structure here, so a lot of laboratories these days who do good work also, but their motto has always been volumes, drive volumes, increase top line. But what again I aspire to do here is create value and not volumes. It's not about one patient or 100 patients, but it's always about the one patient who comes to you or the 100 patient who come to you. How happy do they leave? How satisfied they are? What is the patient outcome? So if they are paying you a certain fee, what are they getting out of it, and how is their life impacted? So when we speak about challenges in the healthcare field right now in India, I would say that all the professionals are working in their different silos. Now, a physician sees a patient, a diagnostician or a lab gives the report, and so on. What is actually needed is a collaborative effort where all the healthcare professionals unify, have one common voice, and that can be addressed to the government. With the hurricane of policies, etc., that are being released by the government, there actually needs to be bodies such as this one, which I'm overwhelmed to to be a part of, like Voice of Healthcare, that actually collaborates different professionals from the industry, gets them together, we brainstorm, and then we advise and recommend to the government what is the best way forward. So we are a quality-based lab situated in Delhi NCR. We're actually a family of pathologists, and we believe in, again, the motto is providing value and not volumes, and it is all based on that personalized patient-centric care that we offer with the best quality of reports. And we are 37 years old today, and we actually boast about having the highest number of doctors per patient and also the maximum number of tests per patient that are performed by any lab in the country. So our future plans would be, again, to embrace technology the way it is coming forward and to leverage technology to give the best output to the patient. Apart from that, increasing and introducing more advanced genomic testing to the patients, not only in the field of diagnosis, but also theranosis and prognosis.